Ladies and gentlemen, welcome to the Centre Hospitalier de l'Université de Montréal, CHUM, Montreal, CCRN, Sunday, September 27.
Dr. Duquette, thank you so much for joining me here this morning to have a little conversation about your work.
Thank you. It's really a pleasure and a privilege to have the opportunity to speak to the FA community.
All right. So you're in Montreal, Canada at CHUM. Can you tell us about your hospital?
Yep, our hospital is our hospital network is the largest in the province, and we cater to about the whole network to about half the population of the province. And our hospital is the main university health center. And we cater a little bit more to the francophone population, but we see both French and English patients here at our center. It's an exclusively adult center, but we're able to see patients who are well, almost exclusively. We're able to see patients who are ages 14 and up here.
Okay, great. So I know your team on Friedreich's ataxia is more than just you. So maybe can you describe your team a little bit?
Yep, certainly. So, you know, I have people around me and support staff who work on the clinical side and clinical research here at CHUM. But right now we're getting organized to form really a Friedreich's ataxia research group here with several PIs. We have someone who's interested in Martin Tétrault, who's interested in RNA sequencing. I have two other colleagues, Nicole Leclerc, who's involved in biomarker research on cerebrospinal fluid. Janelle Drouin-Ouellette, she's not here at her hospital, but she's working at the university, and she works on induced neurons, which might become a model to study the disease. I have another collaborator who's an engineer here, David Labbé, with whom we've started to work on using virtual reality as we don't know whether it can become an outcome measure, but at least it's fun.
Yeah, that's great. I mean, we love all these exploratory things, you know?
Yeah.
That's what research is all about, right?
That's right.
Yeah, cool. Well, so outside of your hospital itself, you guys are a part of the Collaborative Clinical Research Network for FA, a worldwide network. And so talk about the collaboration that you are able to participate in because of the network.
Oh yeah, it's been great. I think one of the main triggers to make this collaboration happen has been all the legwork done by François-Olivier Theberge and people from Ataxia Canada. It's been a great partnership with Jen and yourself, and you know we've got to know you. It was great, and it's been wonderful to be able to meet all the senior researchers who are already part of this extremely dynamic group. So up until now, I've been mostly involved in the FACOM study, but it led to being involved in the draft of new guidelines for the clinical management of the disease, and being involved with consulting with pharma and bringing clinical trials here, because Montreal had been a hotbed for FA clinical research in the 70s and 80s, and thing had kind of decreased a little bit in recent years, and patients were very hungry to participate in trials, and you know, seeing this become a reality again is extremely exciting, you know, for us as physicians, but also and mostly I'd say for patients and their families.
One of the things you mentioned was the FA-COM study, and that is the natural history study, right?
That's right. That's right.
Otherwise known as the natural history study, where people with FA visit their neurologist once a year and kind of get an update on their symptoms, and that really helps feed the planning of clinical trials, because
Oh, yeah.
they can figure out what's the natural history, how the disease progresses over time. And so this leads me to my next question is, can you talk a little bit about the importance of patient participation in the research process from your perspective?
Oh, it's you know, absolutely essential, especially, you know, in the case of FA, but for a lot of the genetic diseases which are quite rare, you know, you know, for rare diseases, it's nearly impossible to bring together 40,000 patients like you would get in a, you know, cardiology study for, you know, a myocardial infarct or stroke studies. So we have to be able to reach the largest number of patients to, you know, make meaningful discoveries, or sometimes, you know, there'll be to see differences between groups when there is a small number of patients is quite hard, even if something is meaningful. So it's very important to reach the largest number of patients. That's one thing. But also patient participation is essential for us to be able to better understand the disease, and also, you know, to see that the community and the patient community is engaged in research. And, you know, from our perspective, it certainly helps us also, you know, attract these studies, attract the interest of pharmaceutical companies to the disease. So yeah, clearly patient participation is essential, and at all stages of disease. So either very early on, because often I'll hear some, you know, I won't say old patients, but patients with more life
Like
experience.
me?
No, you're you're a young man, but you know, slightly older patients who, you know, think maybe, you know, what can I bring to the table? Is it too late for me to contribute? But no, we have a lot to learn from patients who have lived with the disease longer. Which factors have contributed to their longevity, and how could we, you know, what kind of interventions would be most helpful to for older patients, and what kind of symptoms what kinds of symptoms should we address? So it's extremely important to have patients from, you know, all age groups.
Yep. So I've met you before, and you seem to have a real passion for what you do. Why do you love what you do?
There's never a boring day, you know. And you know, patients are, you know, every single patient you meet has, you know, their own, well, they all have their own ups and downs, but they're all, you know, very stimulating, and you know, they help ground you into, you know, why you're doing that. You're doing that, you know, and that's the reason why you enter the field of medicine. I guess for most people, you enter the field of medicine to help patients and to make a difference in the lives of patients. And we can do it through, you know, clinical care, but also, and you know, as you know, sometimes I deal with patients with FA, but also a lot of other degenerative diseases, and it certainly is frustrating for patients to go through all the different steps of the disease, but also very frustrating for the clinician. And it's, on the other side, it's very stimulating, gives you something to fight for. It's always a challenge, but as I said, never a boring day.
Well, and along those lines, when we get there, it's going to be a huge celebration, right? Not only for the patients, but also for you and the rest of the
Oh,
research community that has been, so urgently fighting this for so long.
oh yeah, certainly. And I mentioned that in the written interview, but research on FA here in Quebec started with Claude Saint-Jean, who's a patient advocate, very much like yourself, who led to the creation of what became Ataxia Canada, and so they launched this longitudinal study in the early 70s, starting raising money, and this study in the early 70s, and his goal was to really develop and find what the cause of the disease was, because at the time the cause wasn't known, but also to find a cure. Unfortunately, Claude Saint-Jean passed away and was not able to see the cure, but it's within reach now, and also I'm sure he would be ecstatic to see how far we've come with after research.
Yeah. So I could talk to you forever, I feel like, but I have a couple more questions. Speaking of Claude Saint-Jean, and the work he did, and the work that continues through Ataxia Canada, can you tell us about the value of the advocacy organization in the research process?
So what the role that Ataxia Canada plays?
Yeah.
Oh, yeah, well, they play a very similar role to what FARA did, and now that they're Ataxia Canada, but they were built on FA research initially because of Claude Saint-Jean, and FA is still very much at the heart of their mission. They've been extremely important in kickstarting our relationship with FARA, participation in FA comms. But right now, they've really restructured how they'll finance research on FA, but also on other types of ataxias. And these local efforts are very important to trigger interest among students and researchers to increase the international interest in FA and rare diseases in general. So they're extremely important on that regard.
All right. So you showed me a little bit earlier that you have a couple of recumbent Kyles. And,
oh yes.
Yeah. Love that.
So those were colored by my two older daughters, Constance, who's 9, and Simone, who's 5 years old. So they were very happy to be part of this process.
Well, thank you, girls. I really, really appreciate that. And talking about you personally, how do you stay active and engage your mind and your body and your spirit on a regular basis?
Well, I'll say my 3 daughters, because I didn't show you anything done by the 1-year-old, but they keep me firmly grounded into reality. So that occupies my mind, body, and spirit. Before the pandemic, and it all depends on how busy I am with the family life. I try to run, and so that's how I keep my body fit. But because of the pandemic, I have to confess that I stopped doing that in the past few months. I try to. I have a fascination for modern art, so but as a collector, not as an artist. So that keeps my mind busy when I'm not focusing on science.
Great. Thank you. So one last thing, can you tell us how to say together we will cure in French?
It's a pleasure. Ensemble, nous allons vaincre l'ataxie de Friedreich.
Beautiful. All right, Dr. DUQUETTE, thank you so much for joining me and providing your insight on FA research. And I really hope to see you in person soon.
Hopefully soon.
All
Thank you
right.
very much, Kyle.
Have a good one.